So the last time we were together, we talked about doing a speech sample, and I had you do the Jenny McGuire on Say. I looked at everybody's responses, and the numbers vary, but the problem is that I don't know how much you did, which the number is not as significant as you getting the experience with assessing a sample. So when we left off, we talked about the different areas that you can assess. So assessing frequency, which is what you did in this activity. You looked at the number of disfluent moments and then come up with a severity, stuttering severity. So what you would do with the information that you have now is you take the total number of words and come up with a percentage. So you take the total number of stuttered moments and the total number of syllable productions, and then you divide that to get a percentage, a frequency percentage. So again, you can also break it down by looking at the different types, which is what you did on this activity as well. And then you can get a percentage of the different types. I did see a lot of variety in that area. Many of you were calculating the disfluencies in different ways. And we'll look at that more when we're together again. We looked at part word repetitions. We also talked about whole word repetitions and sound repetitions. The other area which we talked about assessing was duration. So taking the longest stuttered moment, 3 of the longest stuttered moments, and coming up with how long that stuttered moment continued. Looking at secondary behaviors. Are there any secondary behaviors? Are there any escape behaviors? Are there any physical behaviors as well as vocal behaviors? Are they trying to circumlocute or go around the word because they can't get a word out? And then you're going to come up with a severity. So how severe is this case, and where do we need to start with treatment? So there are multiple different tools that you can use, and you use the one just out of Shipley and McAfee, but there are other tools that you can use to assess disfluency. One of the most common ones is the SSI-4, or the Stuttering Severity Instrument, which we again will talk about that when we meet on Tuesday. There's also several types of questionnaires for parents to be able to determine where a toddler or a child is functioning. So here again is the SSI, and I am going to give each one of you a packet for the SSI because, as you remember when we talked about the syllabus, this is something that has to be completed in order for you to pass the class. So I'll be handing those out on Tuesday, and we'll be talking about the process of what you need to do. The SSI looks at multiple different areas. It looks at the duration. It looks at the different types and frequency. So here is page 2 of the SSI. You're going to get a percentile and a severity score. So it's going to help you to determine where that person falls in the realm of having a disfluency. It also has sections for the various age groups, and research for the SSI has been fairly reliable. So page 3 of the SSI is calculating the stuttering syllables stuttered, the percent of syllables stuttered. And this is for non-readers, and you also have the page to do for readers. And like I said, we'll go into this in detail on Tuesday. So here's the scale for rating the severity of stuttering. This is a different tool that can be utilized. It's more subjective than objective. It was originally used for rating by group of listeners. So remember, we talked about reliability. So you have a group of listeners, kind of like what we just did with Jenny McGuire. I had all of you assess that. But again, I need to find out where you stopped, because each one of you, I don't know whether or not you listened to the entire video or you just stopped when you ran out of space, but we'll calculate that later. This can be used, this scale can be used just to kind of get a basic understanding of where the child or the person is. And then you can do more in-depth testing to get looking at specifically what are the areas, what are the types of disfluencies that are being exhibited. This is a tool that can be used for parents. For, we often know that children may or may not speak to us. They get very shy or they're not as comfortable. So we can have the parent mark the number of disfluencies that are occurring with the child in the home setting. It's also a good way to get a view from another perspective. The test of childhood stuttering, or the TOCS, it was created by Gillum, Logan, and Pearson in 2009. So this one's relatively new. It's designed for children between the ages of 4 and 12. And there are 3 different subparts. One section looks at speed, the speech fluency measurement. Another one is looking at the measurement used by the clinician, the teacher, or the caregiver. And then there's a supplemental assessment tool that can be utilized. Keep in mind that the majority of these tools are all looking at the same thing. They're going to look at what are the disfluencies that are occurring. Are they prolongations? Are they repetitions, blocks, etc.? Do they have secondary symptoms? And what's the extent of these disfluencies? How often are they occurring? The frequency. This test has been validated and it is judged to be a reliable tool in assessing disfluency. Another tool is assessing speech naturalness. Some treatments produce fluency, but clients don't sound natural. So they may have a fluent production, fluent conversation, but it sounds very robotic, stiff. It doesn't have the prosodic quality that normal communicative speech has. So this one is looking at how natural does the person's production sound. So this might be something that you would do once you're done with treatment to be able to help the person to see where they are. And this might be something that you use in conjunction with other tests. So clinical research has shown that both untrained and trained listeners can reliably rate speakers on a 9-point scale of naturalness. And this assessing naturalness is now part of the SSI-4. So you'll see how this is done when you're working in that tool. Now, the other thing that's assessed when assessing disfluency is speaking and reading rate, because severe stutterers may produce speech when they're reading at a slower rate, or in general, they may produce it at a slower rate, and so it affects their intelligibility in a conversation. The reason why is because it becomes distracting to the listener, and because of that, the message is lost. And remember, you can have people who stutter and clutter. So they can have excessively fast rates along with the blocks and the prolongations and so forth. So it makes their speech very unintelligible. So we often do, when we're assessing disfluency, particularly with a person who is older and does have reading ability, we want to see how they are producing or how are they communicating when they're reading. And so we will do oral speaking to determine what their speaking rate is while reading, and also determining what are the disfluencies that are occurring within that read passage. So once we've done with our assessment, we're going to want to compare our findings with measures or references. So speaking rates for a 3-year-old, you can see syllables per minute, and this is a range, give or take. And then you can see all the way up to adults, where we produce about 162 to 230 syllables per minute. So that gives you a comparison to be able to look at how are these disfluent moments in the child and adult speech affecting their rate of production. Obviously, if they're having excessive amounts of disfluencies within their communicative productions, then their rate of speech is going to decrease because they're unable to get the message out in that number of syllables because of the severity of their disfluency. So along with assessing the disfluent moments itself, you also need to look at the client's feelings and attitudes. As we talked about at the very beginning of this semester, when it comes to fluency, are as much a counselor as we are a therapist, are treating the actual problem. Sometimes the goal of the person who is disfluent is not to become more fluent, but to become more accepting of their condition. And so there are multiple different tools that can be used to assess feelings and attitudes. The Kitty Cat is a tool that can be used for especially for children. The behavioral style questionnaire is another tool. Impact of stuttering on preschoolers and parents. And then Abiti, Guitar, and Hutchinson's in 2013 presented a poster at ASHA with a tool that they deemed PASS, P-A-S-S, and it uses puppets to assess preschoolers' attitudes toward their speech. This information is still being studied. So for older children, here are a list of some other tools that can be utilized. You also have tools in your Shipley and McAfee that have multiple different questionnaires. Adolescents and adults, these are two other rating scales that can be utilized. The perceptions of stuttering inventory, and the locus of control of behavior scale, the overall assessment of speakers' experience of stuttering are some additional tools. You can see that there are multiple different tools that you can utilize to look at a person's feelings and attitudes. So it is a very important area for you to be able to determine how is this contributing to the person's problem with the disfluencies. And remember, we currently have no definitive determination as to what causes disfluencies. There are multiple different theories out there. So because of that, we honestly need to consider all of these areas when we're doing treatment. So we have to look at feelings and attitudes, because even though that may not be the cause, the problem with disfluency has resulted in this person having a negative self-esteem and a negative attitude towards themselves. That the feelings and the attitudes may not be what causes the disfluencies, but because of the disfluencies, this person now has different feelings and attitudes. So it is another area that's important for us to address when we're doing treatment. But first of all, we've got to find out what that is and how they're affected by it. Here is the OASIS. This is another tool. This version that you're seeing here is for adults, and it is available from Stuttering Therapy Resources. It's another tool that can be used to assess feelings and attitudes. More information on assessment. As you're working with your client, you want to periodically reassess so that you can determine whether or not the treatment that you're using or you've selected is helpful, and the progress that you're making towards the final outcome. Remember, when you're working with disfluency, you have 3 primary areas that you can work on. You can correct the disfluencies. You can make help the client to be able to overcome those disfluencies, and or you can help the client to have a better attitude and feelings towards that. It depends on what the client wants to focus on. Assessments should be conducted at regular intervals, every 10 to 15 weeks, more frequently with preschoolers, because preschoolers tend to have some self correction, even with or without help. So you may see improvement in preschoolers quicker than you will with adults. Assessing stuttering behaviors for all clients, also assessing feelings and attitudes if appropriate. That's the end of chapter 11. Well, on Tuesday, we are going to talk about the SSI and that project. How are you to conduct that and complete that information? I know the calendar says we're supposed to have an exam on Tuesday. I am pushing that back until after the fall break. So I have to make some adjustments, and we'll talk more about that on Tuesday. Refer to Canvas for additional activities. Have a good weekend.